Sure. Yeah, I was very privileged to be able to present the final results of our SALV-ENZA trial on behalf of our SALV-ENZA team at ASTRO yesterday. And the salient points I went over was that the trial was conducted at multiple institutions. The patient characteristics of the trial was well balanced. We were able to randomize 86 patients, 43 to the control arm, 43 to the enzalutamide arm. Again, well balanced and representative of really modern day biochemically recurrent high risk patients, with probably the most important factor, pre-salvage radiation PSA of 0.3. And the primary endpoint was positive. So patients in the experimental arm or the salvage radiation plus enzalutamide arm was superior to placebo. The hazard ratio is 0.42 and was statistically significant. There was approximately a 20% benefit at 2 years in freedom from PSA progression. We also performed pre-specified subset analysis showing that patients with pathologic T3 disease and margin positivity may benefit preferentially from the addition of enzalutamide versus placebo. Probably equally important to the efficacy signal was the toxicity results, which demonstrated that enzalutamide really was very similar to placebo. There were only 3 grade 3 events in the enzalutamide arm versus 7 in the placebo arm, so really no different. The most common and different toxicities between enzalutamide and SALV-ENZA were breast tenderness or nipple tenderness, but only occurring in a quarter of patients, mostly grade 1. And also about 20% of patients had grade 1-2 nausea. So really very little difference in toxicity between the placebo and enzalutamide arm.